No vision and you perish, no dream and you are lost. Your heart must ever cherish some faith at any cost. Some hope, some dream to cling to, some rainbow in the sky, some melody to sing to, some service that is high. This quote by Harry du Outremont was quite used by Professor Emeritus of Morehouse College, Dr. Benjamin Elijah Mays, and it sets the stage for my path to dentistry. I hope to share with you today who I am, my path and my vision for my career in dentistry, and also to give some information about why I chose this great noble profession. I am from Detroit, Michigan, born and raised, very proud to be from Detroit, a product of Detroit Public Schools. And it was in Detroit Public Schools, age of 7, second grade, where they asked, "What do you want to be when you grow up?" I said, "I want to be a doctor." And what was so amazing for me is that not only did my teachers, my classmates, the principal of the school say, "You know what, you can be a doctor," but my parents and my church and my community also said, "He's going to be a doctor." And so it was from age 7 that I was clear that that's what I would be when I grow up. But then in high school, I started to explore different health professions. I looked at mortuary science, I looked at veterinary medicine. I even dabbled with the thought of being a pediatrician for quite some time. But it was the dentist who came into my health science explorers class and shared some details about why he had chose the career that really struck deeply with me. They talked about the independence of the profession, talked about the use of your hands. They talked about the artistry that comes along in dentistry. And one thing that resoundingly was clear for me was the fact that not having to deal with life and death situations. And to a 16-year-old mind, I thought that was profound, that I could be a doctor, but not have to deal with telling someone you have a short sentence of life yet to live. That really rang clearly for me, and from that point on, I started to explore dentistry in the 11th grade. From that point, I decided to go to Morehouse College in Atlanta, Georgia, and I share this information because it's so important for me to be clear that as a first-generation college graduate, so many people feel as though you don't have an opportunity to higher education, to undergraduate education. I recall that I felt like that glass ceiling was proverbially just set right, literally above my head as I went through my path of education. And it was at my graduation from Morehouse College in Atlanta, Georgia, that I felt my whole family, all my ancestors, kind of be released from the bounds of what a glass ceiling can do for a person, that we could attain higher education. I stuck to my choice for dentistry, and so I looked at various dental schools, but chose University of Michigan School of Dentistry for my dental degree. It was an amazing opportunity, but one of the main reasons why I chose Michigan was not only the support that the campus provides, not only the fact that it's one of the premier dental schools in the nation back at that time of 1990, but also that it really supported diversity. Michigan had a history of graduating the first African-American female dentist in 1890, and so entering dental school in 1990, some 100 years after Dr. Ida Gray's graduation, I felt like I would get the support and the care I needed to be the best and the most amazing dentist that I could be. It was in dental school that I clearly thought about specializing, and so my other passion for life that I think is equally important to share was theater and for performance. And so after graduating dental school, as opposed to going right into a specialty program, I decided to take some time in New York City. Spent some time at Harlem Hospital Center doing a general practice residency. I think that's the most amazing thing about the dental profession is you can go right out and practice once you graduate dental school, pass your boards. You can go and open up, hang your shingle, and you can actually practice on patients. I chose, like about 30% of dental graduates will choose to do a residency. And so I did that at Harlem Hospital in New York City, had a chance to not only do general practice residencies, rotations in internal medicine, in oral surgery, and in also in what we call doing a rotation by anesthesiology. So I'm sorry, so I did rotations in all three, oral surgery, anesthesiology, and also in internal medicine. I chose to come back and do endodontics, and the rest is history. But one thing I learned in that time, in that choosing, was that you don't have to choose. What you are will be, you will become. Everything that you do, whether it be theater, whether it be science, whether it be a passion for working with animals, whether it be a passion for doing research, whether it's a passion for writing, you will bring all of that to your profession. And so I share that because at one point in my life I thought I had to make a choice, but I learned that you don't have to choose. You are who you are as a human being. And I circle human being because I think that's where a diversity work begins. First, understanding that we are more alike than we are different. And when I think of diversity in the content and the domain of my profession as an endodontist, when a patient sits down and they have pain in the tooth, my goal is not to worry about their various identities. I need to respect those. I need to be humbled by who they are. I need to listen to what their stories are. Many times patients share so much detail because this is a very intimate setting, the dental setting is. But with that tooth that I need to treat, that pain I need to help eradicate for that patient requires the same attention regardless of any person's particular identity. And so when I look at diversity through the lens of an endodontist, I look at the fact that we are eradicating disease, bacteria, infection, and putting a person in a place for healing. And if I deny the fact that that person is a human being and that I don't listen to what else is going on in their world, I may miss the whole mark in treating that patient. And so again, that service to humankind is profound in my life and it sets the stage in both my clinical practice and my work at the School of Dentistry. And think about my work at the School of Dentistry and diversity. There's a wordle here that just kind of shares what diversity kind of means, and this was done by our School of Dentistry community. What I find my work at the school also involves now is, as we think about diversity, equity, and inclusion, and being a part of this overall goal that our president, President Mark Schlissel, has created as a hallmark for his administration. We've had a chance not only to work together, but also how can we work together with others from different backgrounds. And so we see diversity in a myriad of ways and every possibility of what diversity could possibly mean. But that also allows us to be excellent. We believe that diversity is excellence, and by having diversity in thought and research and mind and background, we're able to serve people, our students, our patients, our staff, our faculty in a much more excellent way. And so diversity matters at the School of Dentistry, and it gives me a great chance to be a part of a place that really seems to celebrate diversity and diverse individuals. I mentioned that in 2003, with my business partner, I was able to establish Renaissance Endodontics PLC. When we talk about the need for others coming into the profession, I think this slide kind of helps to highlight that, the importance of having others in the profession who come from various backgrounds. Out of roughly 150 endodontists in the state of Michigan, me and my business partner are the only two practicing endodontists who are African American in the state. And so when we talk about the need for more women, for people from other diverse backgrounds, we talk about people who have various different identities coming into the profession, we need you in dentistry. If we're going to serve a very diverse patient base, we need to recruit dental students who can reflect that patient base in the dental profession. So I just wanted to highlight that and just kind of share the importance of establishing your own practice. The other benefit of that, of having a practice near where I grew up, is I get a chance to see a lot of the people I went to school with, those who I was in church with, those who I lived in community with. They come into the practice, and it's been a great way to have, if you will, a homecoming of sorts when patients come in and say, "Oh wow, I know you," and they feel so much more comfortable in the services we can provide, and that's been an awesome blessing. And so when we think about realizing the dream, Dr. King was a graduate of Morehouse College, my alma mater, and one of the main reasons why I went to Morehouse College. But he talked about in his vision that mankind must realize that we are tied in an inescapable web of mutuality, which is connected by a common thread of destiny. What affects one directly affects us all indirectly. He calls this his law of reciprocity, and I think for me, it takes meaning in working with students, staff, and faculty, and working with patients to understand that, again, we have more in common than we have that separates us. And so realizing the dream for myself in dentistry, being able to work with students, being able to work with staff and faculty, being able to have a private practice and provide for my family and for many, many, many others through giving back, through volunteering my time, through service to others has been the greatest joy of my life. And so I encourage you to look into our profession. I encourage you to think about dentistry, one, but also think about dental education. Think about dental research. We need you in every possible sphere of our profession to be excellent, to bring your diversity and your own story and background to it, and to see how you can benefit mankind. And so thank you.